অনুষ্ঠানটি নিবেদন করছে অ্যাপোলো হসপিটাল, চেন্নাই।
মাথা ব্যথা, হেডেক বা মাথা যন্ত্রণা, এই রোগে এমন একজনও ভোগেননি বা সাফার করেননি। পৃথিবীতে এরকম মানুষ পাওয়া খুব মুশকিল। আমাদের কম বেশি প্রত্যেকেরই কখনো কখনো মাথা ব্যথা হয়েছে বা হয়ে থাকে। আবার কেউ কেউ আমরা পেন কিলার খেয়ে সেটা চাপা দেওয়ার চেষ্টা করি। কিন্তু জানেন কি, সবসময় মাথা ব্যথার সলিউশন বা ওষুধ পেন কিলার নয়। মাথা ব্যথা অবহেলা কখনো কখনো মারাত্মক হতে পারে। তো কোন মাথা ব্যথা কী ধরনের, তার কি ট্রিটমেন্ট, রিসেন্ট কি অ্যাডভান্সমেন্ট রয়েছে, এই সমস্ত কিছু জানবো। মাথা ব্যথা নিয়ে অহেতুক আতঙ্কিত করার জন্য না, আপনাদেরকে সলিউশন বলে দেওয়ার জন্যই এই অনুষ্ঠান। অ্যাপোলো হসপিটাল চেন্নাই প্রেজেন্টস হ্যালো ডক্টর। আপনাদের সঙ্গে রয়েছি আমি স্মৃতি। আর যিনি আপনাদের মাথা ব্যথা সারিয়ে দেবেন, মানে মাথা ব্যথা হলে কি কি করবেন আর কি কি করবেন না, সেটা খুব ভালোভাবে বুঝিয়ে দেবেন। আমাদের সঙ্গে রয়েছেন এই মুহূর্তে অ্যাপোলো হসপিটাল চেন্নাইয়ের তরফ থেকে ডক্টর আর বালাজি রয়েছেন। ডক্টর বালাজি একজন ইএনটি হেড অ্যান্ড নেক রোবোটিক সার্জন, ফলে এই সমস্ত বিষয় খুব ভালোভাবে উনি বুঝিয়ে দেবেন। স্যার, ফার্স্টলি থ্যাংক ইউ ফর কামিং ফ্রম চেন্নাই।
Namaste.
Namaste. Sir, firstly we want to know what is sinus and primary sign and symptoms.
See, sinuses are empty spaces in the face. It's like a room in the face, because it is filled with air. Because that gives resonance to the voice. That's why when you get sinusitis, voice will be muffled. So, for example, whenever there is air, you float something. If there is air inside, it will float. Similarly, sinuses are spaces in the face which is filled with air. Normally, it is ventilated through the nose.
Okay.
For example, a room is there. If you don't have ventilation, what happens? It will get infected. For you close the room and leave for some time, if you come full of fungus or other infection will be there. Similarly, sinuses, if there is no ventilation properly into the sinuses, they will get infected. Air will be replaced with mucus. कफ जैम होगा नाक का, साइनस का बितोरे। सो बितोरे जैम होने से माथा बेता और नाक बंद बेशी होगा, माथा बेता बेशी होगा, प्लस गला दिखे बेशी कफ जैम होता है। पेशेंट्स आप देखने से ऐसे ऐसे कर रहा है,
हेजिटेशन होता है थ्रोट में और
इरिटेशन, प्लस वी कॉल इट एज पोस्ट नेसल ड्रिपिंग, दैट इज फ्लेम विल कीप ड्रिपिंग इनटू द throat. They will clear the throat like this. And sinusitis causes severe headache. When they bend forward, it will be very heavy, and especially when they take head bath, it will become more. And when they get exposed to AC or when they drink something cold, immediately nose block will become more and sinusitis will become more. So the basic problem is ventilation. If there is any nose block, they are more prone to get sinusitis. So to prevent nose block, you have to avoid ice water, cool drinks, ice cold stuff. Plus, whenever you are in a AC room or in the car, the blower should not blow onto your face. And when you are in a AC room, don't use fan and AC together. This is very, very important. Most of them, they do this mistake.
Okay.
And some people, they may have nose block, हड्डी बेका। हड्डी बेका के लिए नाक बंद बेशी होगा, इसीलिए साइनस प्रॉब्लम स्टार्ट होगा। सो हड्डी बेका ग्रेडिंग होगा। सपोज सीवियर बेका मने ऑपरेशन, एंडोस्कोपिक ऑपरेशन करने से पूरा प्रॉब्लम ठीक चेंज होगा। अदरवाइज इफ इट इज माइल्ड हड्डी बेका, ब्रीथिंग एक्सरसाइज करने से बालो ठीक होगा। And importantly, steam inhalation also will help in all these problems.
Sir, is it a pollution related disease?
Obviously, pollution is also one of the main reason, because when you have pollution, you get allergy.
Yes.
If you get allergy, you will get sneezing. Sneezing, hachi आने से नाक से पानी जोल पूरे नाक पूरा बंद हो गया, then sinusitis होगा. So pollution जगह में मास्क यूज करने से बालो.
Sir, what is causes of nose block?
Nose block का मेन कारण हड्डी बेका. हड्डी बेका sometimes birth defect. बट डिफेक्ट बर्थ डिफेक्ट के लिए ग्रेडिंग होगा, ग्रेड 1 2 3 ऐसे हड्डी बेका होगा. बेका के लिए क्या होगा, ऑपोजिट साइड में मांसपेशी बड़ा, वन साइड हड्डी बेका, ऑपोजिट साइड आस्ते 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 मांसु बड़ा चलो. So because of that both side nose block होगा, one reason. Second reason allergy के लिए tissue edema होगा, inflammation के लिए tissue edema के लिए नाक बंद होगा. और polyp नाक का भितरे मांसु polyp के लिए नाक बंद होगा. Sometimes tumor के लिए नाक बंद होगा. So बेशी कारण वो main कारण हड्डी बेका polyps allergy.
Okay.
Inflammation.
Sir, what do you say? What is the complications and what are the complications in sinusitis?
Sinus problem, sinusitis के लिए खूब बेशी माथा बेता. You cannot work peacefully because
Yes.
most importantly sinus headache is like office headache. It starts at 9 o'clock in the morning and it gets over by evening. So it is happening in the most productive day of your productive time of your day. So you can't concentrate on your work. Sometimes sinus infection it can spread to the eye and
Yes,
it can cause eye problem, and very rarely it can go to the brain also. It can cause brain problem. It can affect the ear and they can have ear problem. Sometimes because of chronic postnasal dripping they develop reactive airway disease we call asthma also can come.
Sir, what is CSF and what is the treatment and what is the complications?
CSF is cerebrospinal fluid. It is the fluid which is there inside the brain.
Okay.
Inside the brain. So there is a bone. See, all other area from the brain, all other areas is protected by a strong bone. There is a very weak bone at the roof of the nose. That is like a very very thin bone, like a puppet.
Okay.
I mean puppet you call, what is it? Puppet, no? That consistency bone is there called as cribriform plate. That is very thin plate. So what happens is when that bone becomes weak, and moreover that through that bone only the smell nerve will come into the nose. From the brain, smell nerve will come into the nose. So already the bone is thin. Because of this multiple nerve entry, the bone will become more weak. Because of calcium or vitamin deficiency or some injury or hormonal changes, that bone may become dehiscent, which means there will be a break in the bone and dura will come inside and it will open up and CSF, brain fluid, will start coming. So how to identify CSF? Sometimes नाक में allergy के लिए नाक से पानी जोल. This is also jol, that is also jol, pani. How to differentiate is CSF will be coming only through one side of the nose.
Okay.
Only one side. There won't be sneezing, there won't be itching, and this CSF will come into the throat also, which will be saltish. It will be salt. And the CSF, if you catch in hand or tissue paper, it will be like a tap water.
Okay.
Jol, plain jol. Whereas allergy or sardi ke liye pani stiff, you put it in the tissue paper, it will become stiff. Whereas if you put it in this normal CSF means if you put it in the tissue paper,
Like
it will be like a
plain
water.
water.
It's like a tap water.
Wow.
So CSF, because now what happens is because of CSF leak, there is a connection between nose and brain. So infection from the nose can go to the brain and cause lot of problems like meningitis and encephalitis. So CSF leak, if you identify, it is an emergency condition. You have to treat it immediately. For that now we do, previously they used to cut and do surgeries. Now we do endoscopic surgery through the nose. Just 2 days hospital stay, bahar cut nahi, problem chesh hoga.
Okay. Sir, আপনি নাকের জলের কথা বলছেন, but what do you say, what is ear infection or discharge?
Ear.
And is it effect on brain?
Yes, ear infection also, again some people they say watery discharge, but it is not watery discharge. There will be pooch, actually pooch. There are two types of infection in the ear. One is safe disease, the other is called unsafe disease. Safe disease, just like what phlegm comes through the nose, it will come through the ear also. That won't cause much problem and that won't be bad smelling. Durgandh nahi hoga.
Okay.
Whereas unsafe disease, they will get very little discharge. It will be blood stained, but it will be beshi durgandh hoga. So that infection can travel to the brain and cause brain infection. So if you have, can't say pooch, durgandh hota hai, or blood mix hoga mane, then beta कान comes unte, all symptoms indicative of unsafe disease which can go to the brain. So you have to be very careful in treating that unsafe disease.
What is the reason of hearing problem, sir?
हियरिंग प्रॉब्लम का ज़्यादा कारण है बेसिक some children, some child, when they are born itself, they are deaf. That may be due to infection in the mother's womb. While the child was, inside the mother's womb, there may be some infection, rubella infection, or sometimes mother could have taken some medicines which could have affected the hearing. So one is by birth itself hearing loss. Other common thing in children is कान का बितोरे पानी जैसे जाम होगा. We call it as effusion, serous otitis media. नाक प्रॉब्लम के लिए कान ट्यूब बंद होगा, इसीलिए कान का बितोरे वो ग्लू जैसे गम बोलते हैं ऐसे कान का बितोरे जाम होगा, इसीलिए कान कम सुनता है. दैट इज फॉर एग्जांपल चाइल्डहुड पीरियड. आफ्टर चाइल्डहुड व्हाट हैपेंस इज समटाइम्स ईयर इन्फेक्शन के लिए कान पर्दा फुटा हो गया, फुटा के लिए कम सुनता है. देन वन कंडीशन इज कॉल्ड ऑटोस्क्लेरोसिस. That is a familial problem. What happens is कान का बितोरे 3टा हड्डी, एक हड्डी फिक्स होगा, मोबिलिटी बंद होगा. 3 हड्डी पिस्टन जैसे मूव करने से साउंड ट्रांसमिट होगा. इकाने एक ही हड्डी फिक्स होगा, सो इसीलिए साउंड ट्रांसमिशन बंद होगा. ऑटोस्क्लेरोसिस बोलता है. देन फाइनल थिंग इज नर्व वीकनेस ड्यू टू एजिंग और बेशी साउंड पोल्यूशन के लिए. बेशी साउंड पोल्यूशन आने से 100 डेसिबल का ऊपर साउंड कॉन्स्टेंटली एक्सपोज आने से कान नर्व आस्ते 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 दुर्बल हो गया, इसीलिए कान कम सुनता है. सो दिस आर ऑल द कॉजेस ऑफ हियरिंग लॉस. समटाइम्स ट्यूमर के लिए ब्रेन का बितोरे अक्यूस्टिक न्यूरोमा बोलता है, वो ट्यूमर नर्व से प्रेस करने से नर्व दुर्बल हो गया.
सर हेडफोन earbuds ये कितना causes रहता है?
Earbuds will not cause hearing problem, but earbuds is not advisable because if there is wax myla, if you put earbuds you are going to push it deep inside bitore jaban. Whereas so don't use earbuds. After taking a shower use a soft tissue paper and just clean outside. If you have hard wax, use drops and meet the ENT doctor once in 3-4 months and get it cleaned. And earphones, of course, you can use, no problem, but loud noises नहीं. Because क्या होगा, आप बाहर ट्रैफिक जगह में जाने के टाइम बाहर बेशी साउंड ना, इसीलिए आप बितोरे साउंड, you increase the sound in your mobile and device whatever, so you will be hearing lot of sounds which will cause damage to the hearing nerve.
Sir, how can take preventive care
for hearing? Hearing, you should stay away from loud noises. While traveling outside, especially now it is a big hobby for most of them to fit extra horn into the car and do honking. I don't know why they do. I always, in my state, I have given a proposal also. Whoever is using the extra horn, they should be punished in the sense like they should come out of the car and they should hear the horn for 2 minutes. If you do that in West Bengal, if the government can do that, because they are sitting inside the AC car and they are pressing the horn, but it is affecting the innocent old age people, children, small children and small young adults who has not done anything wrong. Why should they suffer? Because their rudeness and their show off, people should not get affected. So the main thing is noise pollution, which can be easily prevented. The other thing is painkillers. You should not take painkillers unnecessarily. People always, they are scared of kidney problem. See, if you take painkillers, obviously kidney problem will come. But before that, hearing also will go. See, the hearing thing is, till you hear well, you don't know the value of hearing. Only when you lose hearing, you will know the value of hearing. Because in our country, a blind person will get all the sympathy. Whereas if a person is deaf, they won't sympathize them, they will only mock at them. So that has to change, because that is also one of the important sensory organ which is very, very, very essential for a good life for any human being.
Yes. Sir, we adults are all express our all problem, but how can we understand children hearing problem?
That's what. In child, that's why in developed countries what they do is, when the child is born, first day of their life or second day itself, they do a test called autoacoustic emissions, OAE, they do. That will tell whether the child is hearing or not. It will give pass or refer. If pass means child is hearing, pass. If it is refer, after 6 months we do some test called as BERA, B-E-R-A. So then we can identify for small babies. For example, some children, normally child should start babbling at the age of 1 year, and 1.5 years they should start talking, at least monosyllables or 2 syllables, papa, mama, dada, didi, didi. So they will, didi, yeah, they will do. So in case if they don't start talking at the age of 1.5 years, you should immediately test for hearing. Because in India what they do is, they say, no, your aunt was talking late, your father was talking late, so we will wait, they will say. No, because misconception. 1.5 years to 4 years is the time brain can bend like anything and learn 3-4 languages just like that. If you miss that golden bus, then you have missed the bus forever. So if you have any suspicion that the child is not developing the language properly at 1.5 years, test the hearing. Some children will be normally hearing and normally talking. What happens is, suddenly they will develop this nose block and suddenly they will start using high volumes while watching the TV. Everyone will be at home. Suddenly the child will be using high volumes. Then you have to again check whether the child hearing is affected. That applies for adults also. If you ask some question, they will be shouting at you. You will be thinking they are very angry. No, since they are not hearing properly, they will be shouting a lot. So these are all the simple ways of checking hearing.
What are the most common problem of throat treatment? You have to treat it.
Yeah, throat, commonest thing in our country is pharyngitis and tonsillitis. Pharyngitis is simple infection of the pharynx, throat. Tonsillitis is a common infection in our part. The tonsils are glands located on either side of the throat. And apart from that, our laryngitis is infection of the voice box. Whenever a person develops voice change, and if the voice change is there persistently for say 3 weeks continuously, means you have to consult an ENT doctor to make sure that there is no problem. Because among all the cancers in the world, cancers of the vocal cord are the ones which is easily treated. In other words, I would say it is 100% curable, like thyroid cancers. So the advantage of this vocal cord cancers is early detection, because in the vocal cord, even if you get a small nodule which is even 2 millimeters, voice will change. So that is the symptom. See, whereas for some patients, they may have some problem inside the stomach which cannot be identified early. That takes long time to come up. Whereas in the vocal cord, if you have voice change which is not coming down, which is not becoming normal in 3 weeks time, find out what is the reason. And if it can be simple nodule also. Nodule happens for singers. We call it a singer's nodule, teacher's nodule, vendor's nodule. Whoever shouts a lot, they get nodule. And if the patient is a smoker, or if he is a chronic alcoholic, or if they take this pan and this zarda, whatever, they should always be very careful. If they have voice change, they should immediately check and find out whether there is any problem.
Sir, a neck swelling and thyroid swelling, both are same, and what is the treatment?
No, thyroid swelling happens in front of the neck, here, aage. Other swellings may happen on the sidewards. See, if it happens here, it is a submandibular gland swelling. That is saliva secreting gland is called submandibular salivary gland. That can cause, due to stone it can enlarge, due to tumor it can enlarge. There is a gland here called as parotid gland, that is also saliva secreting gland. That can also, they can have a tumor, so that swelling will be here. Sometimes they get swelling here, that can be, there are many conditions, branchial cyst, lot of things are there. But tumor you have to rule out. TB also, in India TB is very common. TB, previously they were getting TB only in the lung. Now that is called, nowadays there is a condition called extrapulmonary TB. They can develop TB in the neck, anywhere else, so that swelling. Sometimes any cancer inside the throat, mouth, or the deeper part of the throat, what we call as hypopharynx, that can also cause swelling here.
Okay.
So if there is any swelling which is increasing in size, which is not painful, which is increasing in size more than 1.5 centimeter, always do meet a doctor and get the investigations done. That is very important. Thyroid swellings will be in front of the neck. It may
Okay.
be on one side or both sides. Thyroid, sometimes it can be a normal swelling without any reason due to hormone deficiency. Sometimes it can be due to nodule. That is also not cancer. Sometimes it could be due to cancer.
Okay.
So any thyroid swelling, better meet a doctor and get first basic investigations like
Yes.
ultrasound or FNAC, SUI test.
Okay. Sir, what is the recent advancement on ENT on Apollo Hospital in Chennai?
Apollo Hospital, as all you know, it provides the best infrastructure in terms of cutting edge over others, all sophisticated instruments and the anesthesia support, everything. ENT wise, if you see, we do endoscopic surgeries, for anterior skull base, for all sinuses. In
Okay.
even septoplasty, I do only endoscopic surgery, and in fact for ear also I do only endoscopic surgery. Ear, previously they used to cut and do surgeries. I do endoscopic surgery through the normal hole itself. And now the latest, and apart from that, we do cochlear implant for children who don't hear. The problem of hearing is if they don't hear, they don't talk. So two sensory main thing is gone. If you don't see, only you can't see. But if you don't hear, you can't
Yeah.
talk also. So cochlear implant we do, and robotic surgery has come, and we do robotic surgery for some complicated problems inside the
Sir,
throat.
is it possible on ENT sector?
Yes, see, the advantage of robotic surgery is, one is you get a very good magnification and the depth of the tissues, and importantly, if you see inside the throat, there are certain areas which is hidden, we call it as hidden areas, where our hand cannot turn beyond a certain degree, whereas robotic arm can rotate whatever way you want. So it can reach the inaccessible parts and do surgery. So that way it is a very useful innovation in the field of our head and neck surgery.
Okay. Sir, lastly, what message which you want to say to general people?
General people, avoid smoking, avoid alcohol, avoid pan, and
gutkhah also.
gutkhah, avoid gutkhah, and then avoid honking in the roads, so that you can prevent hearing loss to others. And whenever and most importantly, for nose block, don't use nose drops. There is some drop called oxymetazoline drops. Many people I see, they generally use these drops, which gives immediate relief. As everyone knows, any shortcut is always dangerous.
Yes.
You use nose drop, immediately patafat, it gives nose relief, but in the long run it will create hypertension,
Yes.
beshi BP, due to that heart problem and nose problem also, it will become beshi. So don't use drops, don't self medicate. Voice change, any swelling, any nose block, any ear discharge, better consult a doctor.
Yes.
We are always there to support you.
মানে নিজে নিজে আমরা কেউ ডাক্তারি করব না, অবশ্যই যেটা স্যার বললেন যে সমস্ত সাইন অ্যান্ড সিমটমসগুলো হলে কিন্তু চটপট ইএনটি স্পেশালিস্টের কাছে, এরকম এক্সপার্টদের কাছে যাব, তারা যেভাবে সাজেস্ট করবেন আমরা সেভাবেই চলবো। নিজে নিজে ডাক্তারি মানে মাথা ব্যথার সব সময়ই কিন্তু পেলকিলারই উপশম নয়, সব সময় কিন্তু নাক বন্ধে নোজাল ড্রপই উপশম নয়, মারাত্মক হতে পারে ফল। তাই আমরা নিজে নিজে ডাক্তারি করব না। আরও একটা কথা, এই অ্যাপোলো হসপিটাল চেন্নাই সম্পর্কে আপনার যদি এই ডিপার্টমেন্ট এবং যে কোনো রোগ সম্পর্কে যদি আপনার কোনো রকম সহযোগিতা চাই, আমাদের এই অনুষ্ঠানে আমাদের অনস্ক্রিন প্রোগ্রামে যে নাম্বারগুলি যাচ্ছে, আপনারা সেই নাম্বারে ফোন করে যে কোনো ধরনের জিজ্ঞাসা, কোনো কোয়েরি, আপনার মনে যে কোনো রোগ সম্পর্কে কোনো প্রশ্ন থাকলে, কোনো সাজেশন নেওয়ার থাকলে, কোনো পরামর্শ নেওয়ার থাকলে একেবারে নির্দ্বিধায়, উইদাউট এনি হেজিটেশন আপনারা ফোন করতে পারেন। আপনি যে ভাষাতে হয়তো ভাবছেন অ্যাপোলো হসপিটাল ইন চেন্নাই, এটা তো চেন্নাইয়ে দক্ষিণ ভারতে অবস্থিত, আপনি তো সেখানকার ভাষা বোঝেন না, না, অ্যাপোলো হসপিটাল চেন্নাই সর্বদা আপনাদের পাশে। এ কারণেই বারবার ওনারা বলেন আপনি যে ভাষায় কমফোর্টেবল, যে ভাষায় কথা বলতে পারেন, সে ভাষায় ফোন করুন, আপনার উত্তর, আপনার পরামর্শ অবশ্যই পাবেন এক্সপার্ট এক্সপার্টসরা রয়েছেন। স্যার, লাস্টলি থ্যাংক ইউ ফর কামিং ফ্রম চেন্নাই ওয়ান্স অ্যাগেন।
थैंक यू बहुत प्यार करते हैं तुमको सनम बहुत प्यार करते हैं तुमको सनम हसम चाह ले लो हसम चाह ले लो खुदा की कसम बहुत प्यार करते हैं तुमको सनम। धन्यवाद, थैंक यू।
থ্যাংক ইউ। দেখতে থাকুন R+ নিউজ, সবার আগে সবার পাশে।
কি, কেন, কিসের জন্য ঘটল ঘটনা, নাকি রয়েছে তার পেছনে কোনো রটনা? নাটকে নয়, চিৎকারে নয়, চেঁচামেচিতে নয়, ঝগড়ায় নয়, থাকছি শুধুমাত্র খবরে। সব প্রশ্নের উত্তর পাবেন ঝটপট, হয়ে যাবেন আপনি আপডেট চটপট। তাই বলি, আর নয় দেরি,